Hey, everybody. Welcome to Talk to THT, the new show from Teachers Health Trust. And we're so glad to be here today with Mike Skolnick, who is the CEO of Teachers Health Trust, joined us on our show last week. And he's had so much fun, he decided he wants to do something for you guys, the members of THT. So take it away, Mike, and we're going to sit down and shut up.
Okay, so you did the intro, I take it.
Yeah.
Okay, nice. So, anyway, the reason we wanted to really do this show is because we really believe that if you're not part of the community, you really aren't doing your job. You're just a bureaucratic health plan, but we consider this something that's integral to making it effective for everybody so they get the best health care at an affordable price. Um, we're here today. We'll answer any questions. We've got a bunch of them and we'll answer them directly. We've also brought our pharmaceutical partner who we've recently brought into the organization, who is supposed to be here talking to each one of you. And we'll give a little talk on Alto Pharmacy. We'll talk about our partnership, and then we'll talk about serving our kids, which Alto and us are working on together to be able to take care of those who are most in need within our schools. It looks like Melissa joined us. Um,
Oh,
so
there's
I see
Mateo.
that she's there. Okay, so anyway, let me kind of take you through the direction we want to go here. We'll start with me giving a little bit of a one-on-one kind of myself with all of you to discuss where we are as a plan. And then after that, I plan on talking to Matt and Melissa, who are both connected to this. Melissa didn't show her face, she's only showing her audio. But Matt is here live and in person. Say hello, Matt.
Oh, hello. I think Emil
Okay.
is jumping on as well.
Oh, good. So we have the three main people that we work with. There's a lot of people we work with, but three people we help develop this program with that we'll talk to you live. Okay, so a little bit about THT. We are in the transformation. We don't believe that this could have changed, that the plan could have changed if we didn't do what we call disruptive behaviors in this marketplace and bust the status quo. And we kind of have this theory that the first thing you have to do over and over again is ask why. Why? If you don't ask why 20 times, um, you're not going to think differently and you're not going to think better. We had to come in there and question how could something that should be working so well was working so terribly. And we ask questions, but we also ask questions about the community, like why is care in Nevada generally hard to access and why is it so expensive? Why do we say that Clark County has a healthcare system when it's totally no system in Clark County? It's something that's kind of loosely formed with no real central leadership in it at all. I mean, why do we have a network at THT for 3 years with Wealth Health with no accountability and zero value that it brought back to the teachers? I mean, how could you have a health plan that had a benefit structure that made no sense that we saw when we walked into the organization? And we learned real quickly it was written by about 10 people. And so it looked like that had almost a schizophrenic feel to it. Why were there no, if you're working on a value-based type program and you were trying to build something effective, why do we have no payments tied to outcomes for the doctors? Those are questions we ask. I mean, why in Las Vegas do you pay 2 times more for an emergency physician group than we pay for that same exact group that works in San Francisco, which is much more expensive than what you're actually seeing in what the cost of living is in Nevada? Why would you build a pharmacy program and have to deal with that pharmacy program on a day-to-day basis when it changed its formularies daily? It basically made it difficult for members to figure out what was part of their plan and what wasn't. And there was a lot of cost that was being siphoned out of the program to middlemen that we got rid of. But that was there, and you have to ask those questions. And I think one of the weird things that you have to ask is why do health plans pay doctors at 70 and 80% of Medicare in this market, when it takes 100% of Medicare as a physician to be able to manage your office. And unless you have programs and services that give you value-based, um, I guess you call surplus sharing of dollars, and there's a reason to take less, I'm not sure why they do that. And so all of that is what we inherited here. And our job here, which is the second important thing in disruptive care, is to be transparent, but also be vulnerable. You know, one thing I learned from talking to both of you earlier and others is that members in the teaching community in Clark County don't want to be sold. I think you guys were sold constantly. And so we stayed focused on the community, and we connect not because we have to, but because we want to. And we think we can't learn about the community if we don't do that. And we started doing that right away. We had meetings at many of the schools. We got to hear all of the complaints, understand the issues, and we feel good that we're doing well. That we at least understand what you're doing, I should say. We are underfunded, and I've told you that 2,000 times. Teachers have the lowest contribution I've seen elsewhere, anywhere probably west of the Mississippi. We looked at 71 other school systems with similar populations, and the average premium was that their contribution that they're receiving from their school district and their members is $140 more than what we receive here. Yet we still treat it like we can make this work. We have partners that are working with us to make this work, and we think we're doing a good job of doing the best we can with what we have. I'm sure some people disagree, and people still believe everything should be given, every piece of healthcare service that you want, you should receive. And we believe, we wish we could do that, but we're doing the best we can within the constraints. This year alone, because of what happened in 2016 to 2018, within the last 12 months or 10 months, we've spent over $770,000 just helping others deal with some of the issues they experience, some of the past payments, etc. You look surprised. Did you have a question?
Nope.
Nope.
Just
Okay,
surprised. That's good.
I mean, I'm just telling you, that's what we've been doing. And I can tell you our partners do that with us too. Alto's been working very closely with us to make sure we could afford to deliver the pharmacy care and maintain it within the limited payments that we receive at this point. But we know there are issues, and we know people have them, but we do want to be transparent. We are vulnerable. But the third thing that we do that we think is important is we like to pivot rapidly. And that's necessary. If you want to basically go ahead and have this disruptive change, you've got to move quickly. So we eliminated Well Health, if you remember, and within 60 days, we built our own healthcare network. We created a new website. We built it into an educational tool for all of our members. We have everything on there about our benefits, about COVID-19, about what's going on in the world today. We keep it up to date, and we try to stay as open as we can in that area. But that's part of pivoting quickly. You didn't see that website, like the old website, last too long with us. We got rid of the old behavioral health program. It used to be HBI. We saw that teachers were not happy with it. We saw they weren't getting the care. We looked at utilization patterns, and we saw you were underutilizing behavioral health services in a very tense environment, as teachers have, because they have so much to do in such a short time of the day. That we went, and you have, and basically teachers are underpaid in my perspective, from my perspective. So with all that, many of you work second jobs, and we fixed our mission to align with that, to keep out-of-pocket costs lower, and to try to make it so that you can maintain the best health that you can for the limited dollars that you have to pay out of pocket. Because if you can't pay for something, you're not going to go get it. And if you need some care, you should be able to go get it so that you stay healthy. You have to manage your own health. We have a new member service and call center we built because On average, teachers were waiting about an hour and a half to get through, and sometimes 2 or 3 days to get answers. We've tried to improve that. We're answering calls in the last week within 10 to 22 seconds. There are some 2-minute hold times, but overall, we're working really hard on that. Surrounding that, we have an independent clinical team supporting teachers. So if you question the care you're receiving, if you believe the access to care is incorrect and you're going to the wrong providers, if you provide that team with information, they will give you expert opinions. We've had 197 people already use it this year. And you don't ask for it. The people on the phone that answer the questions ask you leading questions. And if it looks like you need some support, they send you to that group, which has nothing to do. We don't have anything to do with that. We want to make sure you get independent guidance, because health plans often have their own bottom line as an interest. And I don't want anybody thinking that when we look at their clinical care. And we're building right now new services for COPD, diabetes, et cetera, that
exciting.
you will see sometime within the next 3 to 4 months. We'll start rolling those programs out to each one of you. And then the last thing that you have to do for being disruptive is to be bold and brave. And I believe we are, our partners are, and we're doing things that really never happen in this marketplace. We basically told the good old boy network in your Clark County market that we just don't even want to know you. And we spend very little time integrating with that network. Our job is to build something that works for the teachers. And if they want to participate and support us, that's great. We have infrastructure. We built a relationship quickly because of COVID-19 without asking for permission. And we've got now a whole IPA of doctors that will take your calls, see you via telehealth, local telehealth. We only have 40% of our teachers using primary care physicians. So now we have an opportunity for you to work with local doctors that can help you through telehealth and support your clinical needs at this point. We're working really hard to build a COVID-19 infrastructure. It's tough because there are no tests in this marketplace right now. Our public health system has a lot to be, national public health system has a lot to be desired. And hopefully in the future, we're able to have an independent public health system that actually supports people no matter what their political beliefs are, so we can have real solidarity in this nation. And we went ahead and changed our pharmacy. And as a result, we have telehealth, we have a new pharmacy. You know about the pharmacy program. Unfortunately, at this point, only 10% are getting the their pharmacies delivered to their home. We'd like to get that up to 100%, but if we get to 30%, I'll be happy for right now. I bet you Emil is shaking his head up and down right now.
You're reading my mind, Michael.
Can I
a lot of our members, by the way, are doing behavioral health and behavioral health services right now virtually, and that's really good. In fact, our behavioral health utilization is up about 30% for family therapy that never existed before. So that's really good to see it's happening. And again, we've got the website. So remember, healthcare is personal, and we want to make it so you can make the right personal decisions, and that's why we're in this. So let me introduce you to Alto. But before I introduce you to the Alto team, or let them actually introduce themselves, which would be easy.
What happened?
I don't know. We lost sound from Mike.
Mike's sound went away. Can you? Okay, well, just a second. We got a short little video we're going to show you real quick, and then we'll be right back for introducing Alto. All right, and
Okay.
we're coming back. Who's this? AJ and Emil. All right, so we're back, and go ahead and introduce yourselves, folks from Alto. Thank you so much for joining us.
Of course. Here, Melissa, do you want to start?
Yeah, my name is Melissa Meow, and I've known Michael now. We've been working together for the past few years, so really excited to share more about our partnership today. Thank you.
Emil?
Let's see, Emil, I'll toss it to you.
Yeah, thanks, Melissa. Emil, I'm a pharmacist at Alto, lead the pharmacy teams, and just really excited to work in partnership with Teachers Health Trust, committed to the teachers. I think Matt will dig into this a bit more. But on our end, like our mission statement in Alto is to deliver on medicine's true promise, which is to improve the quality of lives for everyone who needs it. And I think if you think about a pharmacy in partnership with the health plan, it's really just all about medication access and education for patients that need a trusted resource. And so it's been very exciting to work in close partnership, and excited to bring more value to you guys.
Awesome. Thanks, Mel. Ajay?
Hi, I'm Ajay Khatri. I'm part of the Alto team, and I'm excited to be part of this this partnership. I think getting drugs to teachers and just in general getting access to medications is something I'm truly passionate about, and of the latest joining of these 4 members of the Alto team. So glad to be here.
And then lastly, myself, my name is Matt. I'm the CEO and founder of Alto, and we couldn't be more grateful to have the opportunity to partner with THT, with the teachers, and to be able to have a presence in Las Vegas. It's been super rewarding to date, especially some of the initiatives we've been able to lead during this COVID pandemic. And the whole team, not just the few that are here, but the whole team at Alto, all are very well aware of the teachers of THT, and have all really enjoyed having the opportunity. So excited to chat today.
So Matt, can you kind of give us an overview of Alto, why you decided to work with Teachers Health Trust, and how you think it's going to contribute to, I think, better and healthier lives for the teachers?
Mm-hmm. Yeah, absolutely. Well, a lot there. So let me start with Alto. We really, at the inception of Alto, want to start a pharmacy that, as I'm sure everyone who's used a pharmacy has noticed, found a way to truly try to prioritize patients. And when we thought of what that would mean, there's ways to just make things, simpler, easier. But really for us, it came to access, right? Because you're, as a patient, so often using a pharmacy with a lot less information than most interactions or purchases in our lives. Right? We don't really understand, do I need this particular drug? Is there a different one? Why do I need this again? What is this used for? How much is it going to cost? Is it covered? If it's covered, how much of it is the insurance paying versus me? There's a lot of black box happening. And when we thought of starting Alto, we said, well, there's so much potential benefit to people's quality of life that can come out of medications, why we take them. And yet a lot of that improvement, that impact on lives isn't really fulfilled today, because of all these obstacles that happen along the way of you accessing and getting the medication you need, which is actually our mission statement for a company. It's to fulfill medicine's true purpose, to improve the quality of life for everyone who needs it. And the beauty of the partnership we've been able to build with THT has been the opportunity for us to be very close to the leaders of a health plan, while often as a pharmacy, you're at the mercy of several different stakeholders, and you're fairly far from those who truly care for the patients in a health plan. And the opportunity to do that, not just with any employer group, but truly do that with teachers, was something that really got us excited, because it's really the challenge for Alto is how do we bring this service to everyone, right? That's the last part of our mission, for everyone who needs it. And to be able to bring this to a population that's not just in need, but I think a population that inarguably deserves the best service possible, right, that we all rely on as parents, as individuals, something really, really exciting for us, and has been really for us as a company internally very rewarding. And whenever it's difficult, whenever we're trying to solve a new problem, it's really stories and and projects like these that keep the team super excited and motivate toward a mission, because everyone at Alto really does this to help, not because it's a job, not because you have to go to work every day. We all do this because we all really care and want to help.
It sounds like
So
teachers.
well, maybe we have a deep empathy for that reason.
Yeah.
um, but yeah, so let me stop there, Michael, and happy to go in any direction from here.
Well, I mean, I'd like Emil to talk about, what his goal has been in this market, and also his interactions as he's tried to build this program locally, because he's done a great job to get us moving forward. Can you talk a little bit, Emil, about it?
Yeah, yeah. Thanks, Michael. I think from the start, if you really think about the pharmacy space, what the market's asking for, what the market's able to deliver on so far, you've obviously got your large players in the space. You've got Walgreens, CVS, these large incumbents that have been around 30 plus years. And what's been interesting is they're recently pushing delivery, right? Like you can get delivered medications to your door, especially right now. I'm sure the teachers are seeing this with the impact of COVID. Hey, we can partner with Postmates and get medications to your door. Honestly, I think that's a miss. That's never been the focus on our end. One of the value props of Alto for sure is delivery to the teachers, which right now more than ever, especially with this pandemic, you really see the value of not needing to go physically leave the safety of your home and to go and get access to care. We bring it to you, and I think we're seeing that as a trend overall in the healthcare space. That you as a patient shouldn't have to go and seek access to care; it should come to you. You're seeing that with telemedicine. We're driving that for pharmacy, but I think how the market's reacting to COVID pandemic around delivery is honestly a miss. I think the key here has always been, sure, getting medications delivered to patients and making sure that they have access and getting medications in their hands as quickly as possible, right? Time to treat is important. I think outside of that, patient engagement is what it's all about, making sure that patients can engage with the pharmacy, see information right at their fingertips, interact with the pharmacist whenever they need to. Questions come top of mind, make sure that they have that patient advocate with them throughout their care journey. And I think that's kind of where we've built something different, a different experience where patients can engage with us on a mobile platform or on the internet, on our web app, and it's so much more than just being able to get the medication to the patient. What it's all about to us is, if you think about the patient experience from the doctor's office into the pharmacy, you as a patient, you really don't know anything about the price of your medication, like Matt mentioned. You don't know anything about what's covered through your insurance, what's not covered. If the medication's in stock, oftentimes you're going to the pharmacy and all of those pain points, of course, face you front and center right when you're at that counter after you've waited in line for 10 minutes next to everyone else. And I think that's what's important. It's personalization of care and deep engagement with the pharmacy. That's so much more than this transactional model that everyone's kind of learned to expect from a pharmacy. And what we're trying to choose, change that behavior and make sure that we're building a relationship with the user, making sure we understand from a clinical component, what is this patient going through? How can we coach them? How can we work with them to hit their goals in the long term? It's been really unique for the specialty patients that we take care of that are part of Clark County School District. And so what we've done so far is a great question. In July, um, we launched a pharmacy locally for the teachers here in Las Vegas. We built out a facility. We staffed it. We have couriers dispensing medications, and we've just constantly tried to figure out ways to engage with patients and make sure that they're able to make the choice whether they want to use Alto or another pharmacy. To us, it's besides the point. It doesn't matter, but we're hoping that patients give us the opportunity to really show that there is value in deep engagement with the pharmacy. So we launched the pharmacy in July, and we're taking care of patients throughout Clark County School District now. We have delivery window, free deliveries. We're looking at expanding delivery windows, and so far the feedback that we've gotten, we love feedback, both positive and critical feedback for sure. The feedback that we've gotten overall has been relatively overwhelmingly positive, which is a great sign, and we're excited to continue to scale and take care of more teachers. I think coming up in the next few weeks here, we're looking at starting to engage with the providers across Clark County to try and showcase that, hey, Alto's here. We've built tools not only on the patient side but also on the provider side to help doctors understand what medications are covered, what isn't covered at the pharmacy level, so that at point of prescribing, doctors aren't writing prescriptions and sending them off to a pharmacy where a patient or a teacher has to realize at the 0 hour, like, oh, my medication's not covered. It's our belief that that's not the intent of healthcare, and we're trying to change that.
Let me jump in for just a minute.
Sure.
And everything you've said is spot on. Like before you guys really kicked it off, I had delivery from CVS once, and they charged me like $9 to have it delivered to my house, like 20 feet away. But anyways, so I really appreciate that. But I did want to. I'm looking at the comments that we're getting on the live, and man, people are saying I love Alto. I just switched to Alto. The transition's so painless. First since the time I've been since 1990. So you guys are doing a great job.
I appreciate that to everyone who's listening. But thanks for giving us a shot.
And this is kind of joking, but kind of
Sure.
I want to know why sometimes I get a caramel and sometimes I don't get a caramel. So
caramel, yeah.
Because sometimes I get a caramel
with the hardball questions.
Yeah, sometimes I get a caramel and it's delicious, and that's the whole thing I'm looking forward to. And then sometimes I open the box and it's not. And it's usually I think somebody pointed out earlier, it's when I get my diabetic medication. Is there?
Don't get one.
I don't get one when I get my insulin, but I do get one when I don't get insulin.
Oh my gosh.
That's correct.
So
here.
I'm just saying, if you're gonna give a tchotchke to non-diabetics, you gotta give a tchotchke to diabetics. So either get some sugar-free candies, something. I'm just saying.
Okay,
Jeremiah,
no, that's funny that you should say that. Yeah, that's funny you should say that, Jeremiah, because I thought my husband was messing with me. He's like, oh, did you see this caramel? And I'm like, where did that come from? And it was just a random caramel, but it fell out of my bag. And I'm like, oh, and I was worried he was like, messing with me. So I didn't
have
eat
some
it.
candy, little girl.
But now that I know, I'll be looking for that from now on.
Yeah, and I think jokes aside, like, yeah, we and this goes back to personalization. It sounds like we have some work to do. So I appreciate the feedback, but I mean, honestly, that's what it's all about, right? Like, making sure you're not tone deaf to patients. I think patients that are diabetics, like, let's make sure we're personalizing the experience that they have. I think the caramel call-out's great. Matt can probably speak to the story there on that one. Jamie, co-founder with Matt, just really, he wanted to make sure that we had these like breadcrumbs of delight, this delightful experience for someone that typically just has a really tough, challenging time dealing with a pharmacy, right? And it's like, you go to your doctor's office, you have a diagnosis, whether it's like something really severe like diabetes for the first time, or maybe it's something like, I just have a sore throat, I have a viral infection. But either way, like, the pharmacy is just like the last obstacle you have as a patient before you can just go home and get better, right? And
Right.
so that was this, Jamie was really adamant on creating that final like breadcrumb of delight, and wanted to make sure we had these awesome caramels that we could dispense to patients.
But you're right though, that personalization piece is so key, because I feel like in today's society we are so out of touch with one another, and it's just those extra little smidge of, you know, generosity that like makes you think, oh, these people are in it for good reasons.
And-
So
Right?
Yeah,
Yeah.
like-
Like you might get, you know, yeah, you might get your medication, sure, but like, yeah, just wanted you guys to have a smile as well.
The other
That's
thing,
cool.
Good about
the
it.
other
So-
thing I appreciated about Alto's app, which made me think about not using a local pharmacy, is that it tells you if it's in stock or not. Because
Mhm.
I remember, and it was I have asthma. If you can't tell, I have a little in there right now. But I needed a rescue inhaler, and
Sure.
for some reason, 3 different pharmacies in my area didn't have it, and one of them kept me waiting like 20 minutes while I'm sitting there trying to breathe. And so it's just nice to say, okay, oh, so this one will be here tomorrow. The other one's, for whatever reason, is out of stock. I know, you know what's coming and what's not coming,
Right.
versus sitting at a pharmacy. Like
Yeah,
you were talking
it's
about
it's
earlier.
amazing, Jeremiah, how low the bar is set in the pharmacy industry, to what brings an amazing experience to patients. Like you built an app, and you're pulling through what's in stock and what's out of stock at your location. It's not impossibly hard, right? And but like, just the fact that we're doing that is so different than what you could expect from Walgreens and CVS. Granted, I will call out full humility here, we don't always get it 100% right, but just generally, like, that's the concept of making sure that all of those surprises that you have as a patient when you physically show up at a pharmacy, again, like, oh, sorry, we don't have your insurance information, or sorry, prior auth is required, you can't get this med today, or sorry, we're out of stock on this. All of those surprises, like, granted, sure, those are real things that might still happen, right? We might not have your insurance information, we might not have the medication in stock, hopefully we do, but we might have to clarify something with your doctor. But like, let's get that information to you ahead of time. As soon as we find that information out, you as a patient should, it's our responsibility to make sure you know that information at the same time that we know that information.
So we, crap, excuse me. I lost my train of thought. It'll come back. Continue on.
Okay.
I'll be back around the station in a few minutes.
Yeah. Well,
Sure.
I can jump in and just share more about the little details that Alto really focuses on. There's another example that I love where there's certain medications that will lead to a side effect of chapped lips. And so in those situations, we'll include a free Alto chapstick in the box. And so I liked Kristen's comments where we're really trying to create the experience of receiving a care package to demonstrate to our patients that we're more than just a pharmacy delivering medications. We're really here to be a partner in your healthcare. And so all of these little touches are really meant to demonstrate that we want to be that type of partner to everyone.
Very
That's
good.
really good. Yeah, you know, and I was gonna say too, especially like educators, most of us are those warm and fuzzy people. So, and that's the thing is when you open the door like that, I mean, we're more than likely to jump on board because we're like, wow, that was just that little extra touch of niceness. So that's important in my book. So, and I will tell you right now, I used Alto, and I was telling Mike this the other day. I used it a couple weeks ago, and I was just blown away with how efficient and like just on it everybody was. And that's a good thing to have, especially like with this whole COVID situation going on. I know there's a lot of stress that is happening, and it's just important to be able to see that you guys are still, you know, you have your eye on the prize, and then you're trying to help the people that need the help. So, and that's important.
So I have 6 questions that members sent to me that I have not rehearsed with Matt and team. So is it okay if I present those questions to you?
Please do.
Okay. So question 1 is, why is it cheaper to buy our medications without using insurance at Alto? And Walmart has most medications even cheaper than Alto, not using our insurance. Interesting question. I mean, I just received these, so.
You mind if I jump on that one?
Go ahead.
I think that's a fair call out, and something that we're constantly trying to improve on. Cash pricing basically comes down to our cost of goods, or what we're able to purchase medications at from our wholesaler. I think over as we scale and over time, our commitment is to make sure that our cash pricing is not just competitive, but best in class to competitors in the market. Walmart, of course, has a little bit larger scale than we do right now in terms of the commitment that they're able to get from wholesalers. So not only that, Walmart has a scale to go directly to pharmaceutical manufacturers. We see that on our roadmap as well. Right now, I can say our commitment is that we want to at least match what's in the market. So oftentimes on our care team, we're putting forward cash prices to members and to patients. But please continue to provide us with feedback, and we want to make sure that we're not egregious in pricing at all. That's not our goal. Our goal is to take care of you and make sure that you don't have to shop around for best pricing in the market, that you don't have to price compare. So please continue to provide that feedback to us, but know that we're taking that seriously, and we want to make sure that we're focused on providing value back to you guys.
I mean, and correct me if I'm wrong, isn't pharmacy at times a loss leader for places like that? They're taking a loss on medication because they know they're going to get you to buy other stuff at the store.
It can be. That's an interesting call out. It's changing a bit, and the market's changing a bit now. But I mean, Target Pharmacy is a great example of that, right? Like loss leader, they really didn't know how to manage it, which is why they sold it to CVS. And yeah, they wanted you. The SLAs for a prescription dropped off at a Target Pharmacy, or the expectation, I should say, is make sure it takes a minimum of 30 minutes to fill that prescription, because we want to make sure that our customers, or they would call them guests, are able to roam around the Target store and shop. And so absolutely, Jeremiah, oftentimes it's a mousetrap.
Interesting.
But again, that's pharmacies always, I shouldn't say always, it can oftentimes be treated like that commodity. And at Alto, that's all we're focused on.
That's all you do. So
it's front and forward.
I think.
Can I ask the second question here, because I want to get this one in?
Sure.
Absolutely.
Can I only order prescription medication from Alto? At CVS, I can also order over-the-counter medicines such as Tylenol, vitamins. If so, how do I go about doing this?
Oh yeah, that's my favorite question. It's something we've been meaning to do and wanted to do for probably a good year so far. It's in my mind, it's probably one of the biggest areas where we have to go and invest in. There's some nuances around, supply chain, the stock, and particularly right now with COVID, it's particularly challenging given, pharmacies across the U.S. are running out of a lot. It's just a supply problem, but it's in our plan this year to build this out, especially these sort of very obvious over-the-counter medications like flu medications, Tylenol, Advil, cough, the common things that you would go buy at your local pharmacy. We plan on having all that soon as humanly possible, and that should be before the end of this year.
Although you guys do sell pill splitters, I found out.
Yeah, well, honestly, most over-the-counter meds we have and we can get, and often when people just message us and request it, we'll just find a way to get that over to them. But in general, we don't have an offering where it's easy for you to add those, select those, and then add them to your order to save you that trip as well. But we do actually have Tylenol, because often it's actually prescribed as well. And so really for us, it's just getting all these pieces together to work, make sure that the software is right, the supply chain is working. Then we can launch that more broadly.
Yeah, and just adding on to that, and good call it, Jeremiah. So we do. The answer is yes. We do carry over-the-counter medications, particularly right now because of COVID. The supply chain for over-the-counter medications is really dry, and that's across the United States. We do still. That's not to say we don't have over-the-counter medications. It's just to say that it's lower than it typically is. And I think to Matt's point, what Matt's trying to say is his vision and hope is to make sure that this is very easily accessible by patients on the app, right? The app isn't because it's like this cool technology thing. The whole purpose of it is to make sure that it's accessible and easy to use so members can get access to what they need, whether it's a medication or over-the-counter product. So at Alto, we do stock over-the-counter products. So to Jeremiah's point, if you're contacting our care team and you're questioning like, hey, can I get Tylenol? Yes, you can get Tylenol. It's just Matt's vision is to make sure that you don't even have to reach out and message us to get that in the future, that it's just going to be in the app, and you'll be able to add it to your prescription delivery. So you get a caramel and you get your over-the-counter medication.
Unless
as
you're
well.
diabetic.
Yeah, unless you're diabetic. You get
Your
your
color, we
sugar-free
should
caramel.
look for sugar-free caramels as well for inclusivity of everyone.
It's all
Yeah.
right. Go ahead, number 3
That's
there,
true.
Mike.
How do you handle specialty meds that require refrigeration, especially in the summer?
Oh yeah, we actually have an accreditation called URAC, which took us, well, Emil, you led this initiative, I believe 18 months from start to finish, to truly prove, amongst other requirements, that our way of handling cold chain was up to par. So we have special packaging, we have cold packs. We also, most of the specialty medications are not shipped by mail, right? So they're going to arrive and leave from the same place on the same day, and so they're not staying out in the sun for multiple days or going through multiple facilities across the country over a few days. It's really within 24 hours. And then often these expensive medications that are requiring refrigeration will be sort of handed to a human being, right? They won't be left out. So that way, it's how we make sure that they stay cold. And we actually put these little temp trackers, these little cardboard with a little dot on it. It'll change colors if the temperature inside the package goes beyond a certain point. And so that way, you even as a patient can make sure, like, yep, this was kept at the right temperature. And if it's not, we'll take it back and give a new one. But generally it works pretty well.
I got excited because I realized
Yeah, I saw that.
I had it.
That's it.
I still do have the little card somewhere, but
That's
it wasn't in the same spot.
You'll see this big sticker contains medication, because sometimes people would think those are just like, package stuffers. It's like, no, those are the meds. You got to make sure to open that. So put these big stickers to make sure this is not garbage. This is your medication.
Okay,
And really quickly, that is a differentiator from CVS and Walgreens, because even though some of those pharmacies claim they can do delivery, they can't do delivery of refrigerated medication. So wanted to highlight that.
Also, they could send it by mail. It could sit in your mailbox for hours, whereas with delivery, you could time this thing.
Right.
Yeah.
Right.
I
Yep,
have
that's
to
true.
keep moving, but I don't want to ask the other two questions, but I'll answer them for you real quick. Why should I switch Alto when I'm already set up at CVS? I think you've heard an answer from Emil and Matt, and I don't need them to say that again. It's up to each individual members what their responsibility, what they would like for the best pharmaceutical care that they need. So is there anything you want to add to that, or?
I won't be going back. I mean, even if the price is negligibly different, the convenience factor for me is way out of this world. And looking forward, hopefully, as you guys continue to grow with members coming over, and you'll be able to expand those delivery times, from like 4 to 8 instead of 6 to 9. 9 o'clock getting a medication to your door is a little, but it just, this again, convenience wise for me, I don't want to go back to a regular pharmacy.
Yeah, well, especially with everything with COVID. Yeah. I mean, everything in this current time goes back to the coronavirus. I mean, who wants to go and take a trip to the pharmacy and potentially be exposed, especially if immune compromised or you fall in one of those high risk categories? This is the best idea that you could possibly do, and it's one less thing to worry about.
Yeah, appreciate it.
And then,
Go ahead.
Yeah, I think
Michael, I just wanted to.
Go ahead, Melissa. Go ahead.
Oh, sorry. I just wanted to add quick perspective as a parent of 2 young kids, even separate from coronavirus. You think about, as many teachers are parents with kids as well, and after work you just want to get home as quickly as possible, or if you make a trip to the pharmacy, you don't want young kids clinging to your leg as you're standing in line at the pharmacy. So just having that perspective for those that do have families, the convenience aspect is huge.
Yeah, I have a 4-year-old and he likes to touch everything and anything when we're out in public.
Yes.
And I'm like, don't do that. And even before this whole thing with the COVID, I was like such a germ freak, totally mycophobic. Tell him, don't touch that. So I can relate to that. I can totally identify with that.
So I'd like to thank one person that's not up here today, which is Rory Wright, who works for THT. He worked hand in hand with Emil building the pharmacy program. He was kind of their blocker and tackler in the state of Nevada to teach them how to work in the state of Nevada effectively. And he deserves a lot of credit for us getting Alto here. And I can't give him an applause because nobody would hear me, but I'm giving it to him because I think he was a key part of this. Would you guys agree?
Thumbs up.
Yeah, definitely agree on our end, and then on our side as well. We've had this group has been super engaged in supporting our partnership with THT, with Michael, with Rory, and then we also have our broader team at Alto. We're quite large now, about 440 people.
Wow.
Alto's spread across, we have six locations. More coming this year, but just always going to be committed to this partnership. It's a really unique opportunity to take care of this patient population that we feel very strongly about. And this is another kind of context around delivery windows, because I think it's just important to share. We're always open to feedback and improving. Initially, when we launched delivery in San Francisco, it was on-demand delivery. There's whenever you needed it, we'll send you Matt would hop on his motorcycle and deliver prescriptions to people like 2 hours away from our pharmacy in San Francisco. And we realized like on demand delivery was not a great idea. There's use cases where it makes sense, but it is hard to manage. And we did a lot of just user research and realized, at least in the markets that we were serving, patients often requested like, hey, it makes a lot of sense where I go to see a doctor in the morning and they'll send a prescription over and it's an urgent medication. Like I want to get it sooner rather than later. So why not allow delivery like during the noon to 3 window? It's kind of midday. I'll be at work at the office. It'll make sense to deliver then. And then the 6 to 9 delivery window is just people leaving work, going home before their kids' bedtimes. We don't want to ring doorbells after 9 o'clock. And so we had these 2 3-hour windows that we landed on, 12 to 3 and 6 to 9. And then going into Vegas and supporting THT is a very different market, right? Our immediate reaction is okay, it makes us nervous to deliver medications to schools during the day. Want to be mindful of students and what that process is like and the types of medications that we're distributing. We just want to make sure that we're doing the right thing and being diligent. And so we left the evening window, and now just to the call outs that I've heard on this call, like let's make sure we're constantly sharing that feedback because we're open to changing and to tailoring this to what makes sense for this particular group. And so I know Stefan, our head of production delivery, is constantly on calls with Rory, like Michael called out, to make sure that we're getting feedback and that we're reacting and adjusting accordingly. But just wanted to share context around the delivery windows and how we started establishing them.
And can you talk about when there's...
He froze again. His connection's unstable.
No worries.
I'll just take a second while hopefully his video catches up. The other thing, I obviously had a delivery the other day, the no contact delivery.
Oh, here I am.
The no contact
Hey,
delivery
Michael.
is very, very great right now as well. Especially that one that said it needed a signature. I met her. She was telling me she's here, and I came to the door. She dropped it about 6 feet away from my door. And she's like, "I'm going to sign this for you, okay?" I said, "Sure, go ahead." And because there was somebody who said, "Tell your couriers that we want to tip them. Don't leave so fast." But anyways.
So right now, I wanted to tell everybody about a program that Alto's working on with us. Can you hear me?
Yes, we catch you.
Okay, that Alto's working on with us about, I'd say 3 weeks ago or 4 weeks ago when the COVID scare began and we decided to shelter in place. We were like the first company in Las Vegas to do shelter in place, and we built the infrastructure for it. But at that point, Alto has a chief pharmacist. They call it a PIC, a pharmacist in charge. And he got together with Rory and they said, we want to do something with our delivery services to help those in need the most, who are hungry, that lose out on food as a result of the COVID virus situation. And it's hard to deliver food to people's schools if they're not there. So we got together with a company called Serve Our Kids, and it's a foundation. They work with those kids that need food Wednesday, Thursday, Friday, on the weekends, and support them in their need for nutrition. And we've delivered to now 204 different families in less than a week. So we're doing that. This team is working effectively together. Sarah, who's not on the call, is in charge of the program at THT. And Bong is taking the lead over at Alto, and we're showing what collaboration really means. And if they want us to deliver to 300 members, we deliver it to them. Never do we come in contact. We pick up in the back of the warehouse, we deliver to the porch or to the doorstop or to the front of the apartment. We talk to people, let them know we're here. Similar to the pharmacy distribution. They know we're here, they pick up their food, and then we take off, and it's working quite well. We've had teachers. This is managed by teachers and counselors, and they've actually been in tears because of the program, because they thought kids were going to lose out on the opportunity to eat. And it's working quite well, and I'm very happy with what I've seen so far. The partnership is nice. We just want to make sure we get more utilization from the teachers locally. Any questions about that? Did you want to? We don't need to put up the slide, okay?
It's people are seeing it.
Oh, they are.
Yep,
Okay.
I got you.
Okay, and then lastly, I had some questions come to me.
Sorry, Mike. That was called the Serving Our Kids Foundation. I don't think you said that out.
Okay, I said it wrong. I meant Serving Our Kids Foundation. My bad. I'm almost perfect.
No, you're great. We do want to wrap this up, and we had some questions from members that you guys wanted to hear from Michael. And so if you don't mind, Michael, we're just going to ask these to you real quick, and
sure.
While these members are still watching. So first it's like a kind of a two-part question. COVID-19, first question, first part of it. How much will I have to pay if I get COVID-19, if I get admitted to the hospital for 10 days and put on a respirator for 7 of those days?
You'll pay zero out of pocket. We're covering COVID-19 costs.
All right. And there was actually somebody way back said they think that their member had COVID in December.
In December, yeah. I think Rebecca was already.
They said send an email.
Somebody had handled that. They gave out the email address to contact, because I did see that question. It was from one of our viewers.
Okay.
Yeah, I know somebody asked something additional too about a child that a dependent needed coverage, but their coverage was new and they wanted to know if it would be covered because they didn't know when everything takes effect. And we're just going to cover that dependent.
Wow, so that's excellent.
For whoever that.
So that was that part. And once enrollment paperwork has been submitted for dependent, blah blah blah. So you're good on that. Next ones are from a retiree. It says, for those of us retiring this year, who specifically can we contact to set up coverage after separation from the district? Who should they reach out to?
Well, there's 3 ways they can do it. One, they can go on the website, look for the information, actually connect via website and begin the application process. 2, they could call our call center who understand the process. They could help them. Or 3, they can go call they could send us a text or send Mike Steinbrink a text and he'll get the information and he can get back to them too. We have 3 different avenues.
Yeah, Mike Steinbrink is an excellent resource, and he's been on our podcast before, and we'll have to have him come back again sometime.
Yeah, he's incredible.
he spends time going out to every school, talking to as many principals and members, and he gets information, finds out about a problem, and it's taken care of right away.
Yeah, that's such an important one too. Mike has been an asset, a big one. I mean, in the fact that he knows what the teachers and what they go through, and that's such an asset.
Why do specialists here think that it is okay to assign patients to nurse practitioners? This seems to be a very common practice since becoming a member. If it's as if it is acceptable, this practice needs to end, and it is absurd.
Well, a couple of things. One, nurse practitioners can actually open up their own practice and work with patients. So, and I know some nurse practitioners that I think are as good, if not better,
Better
than
than,
physicians.
yeah.
So I don't really think it's fair to look down on a nurse practitioner. I think we should be embracing them, number one. Two, we have access issues in town, and providers want to see as many members as they possibly can because they don't want to leave people out in the cold who have need. And so therefore, the nurse practitioner becomes a good avenue for that member. And thirdly, it's really not in our control as a plan, so I have no way to control that. We have ways we compensate for docs and nurse practitioners, but I'm open to helping members. If they don't want to see a nurse practitioner, our team could help them get to
A
a
different
doc.
doctor.
But I think you got to be careful turning your nose down at a nurse practitioner because they are awfully professional, useful, and some of them are just excellent, and they understand protocol and evidence-based medicine better than most.
Well, I'll tell you what, and I think this just comes from experience. I'll leave this they who must not be named insurance group here locally using, I don't know what they call it, medical homes. No, that was us. But it was something where the extenders, a physician extender, they're part of the doctor's team. And again, I've never had a problem seeing a PA. I've never had a problem seeing a nurse practitioner. So, but I understand, like, people with
my 2 cents. You don't have to agree with me. I just have found nurse practitioners in some primary care offices and some specialty offices to be as good, if not better.
Yeah, more willing to listen too. Yes. A lot of times.
That's true. Very true.
There are also a lot of nurses now. I mean, now there are more and more male nurses, but it could have been something that people just was a form of at the time, and on older days, it could be a sexism thing too. I don't know. Throwing it out there because I just don't understand that.
Can any of my family use the IPA Health Network for a doctor appointment, even my kids? This is telehealth, the new thing we just came out with.
Right now, even your kids can use it for telehealth, but for a primary care doctor, it would be for adults because they're adult physicians, medicine. But they will help either on any of the telehealth calls.
Just two more. Teaching can be physically demanding. Why doesn't THT cover weight loss surgery? And
you mean bariatric surgery?
Yeah, I want that lap band.
So there's good reason that we should and good reason that we shouldn't. So first of all, 50% of the bariatric surgeries work. I've been really researching that because I'm trying to build a program for us. But 50% of the programs of the bariatric surgery works or doesn't work. There are 3 types. I'm not going to give a whole, classroom evaluation on it right now. But most of them and all of them require that work well. Like MGM has a program where they offer it, but they require 3 months of behavioral health therapy before you go into it and proof that you can lose weight where you are right now. I kind of admire that program and think it works well on the front end, but then they use a third-party vendor to do the bariatric surgery and run it like a bundle. I like the concept of bundling, but I'm not sure that I want to give a company the ability to bundle our members' bariatric surgery. I'd rather find the best, build a program, set up our own bundles with them, and work effectively, locally. And we've identified who the best are at this point.
And so it's something you're looking at potentially.
Give us till January, we'll have something in place.
Excellent. And then last question before we really kind of wrap up here. Well, it's a claims question. Last year, Allegiance charged me nearly $3,000 due to extremely poor recording and charging services/prescriptions to my wife's account as opposed to my account. I had passed my out-of-pocket max and was continually charged. This year, it's still happening. I've already hit my out-of-pocket max, yet I'm still getting charged. Allegiance, although better than TriStar, is still woefully poor at billing and keeping charges billed to the correct individual and keeping track of someone's OP max, out-of-pocket max. Help me
Okay,
with this.
so let me answer that in multiple ways. One, as far as out-of-pocket max, we build what are known as accumulators, which takes pharmacy, it takes professional, it mixes all of your medical care, it adds it together and builds what we call an accumulator. And once you reach your max, you shouldn't have to pay. That's one. But companies such as Kaiser and even HealthNet to a degree in California have put that on the individual more so than on the insurance company, because we don't get bills until 3 months later. Pharmacy comes in real time, but beyond that, we can't be sure. And we have what are incurred but not reported expenses. And I think that's unfair to the member, but that's the way the health system works right now, and we need to fix that. Lastly, when you talk about our third-party administrative company, I mean, we inherited that. They have older systems. There could be issues with what we inherited there, but we've built the infrastructure now that we could actually look at the claim, look at the expenditures, figure out where it is. We could do quality checks. And within the next 2 to 3 months, we'll be ready for that. We might decide to process claims on our own in the future. We might not. We're in the process of evaluating that right now, but we need access to the claim system, real-time access, and we don't have it like we should. And that's something, again, I inherited. I have very little control because it's a contractual relationship. I find them to be good, and I find them sometimes to be bad. So it's a mixed bag when it comes to Allegiance. Probably any TPA. That's why it's good for plans to take responsibility themselves.
Mm-hmm.
Hey, well, we are pretty much at the end of our hour together. And from us at Teaching Day Podcast, we thank you so much for coming to us and asking us to help you out get this started. It's been a lot of fun. Thank you, Matt, for joining us. AJ, Melissa, Emil, for coming in and telling us about Alto, this great benefit that teachers in Clark County have access to, and hopefully it'll expand and you guys will be prosperous. And only when you guys are prosperous, it's going to help everybody's costs go down, I'm sure. We talked about scale earlier, Emil. So
yeah, and then to everyone that's listening now, especially during this COVID epidemic, everyone's sheltering in place. We're here to help. Let us know.
This, from what I understand, and correct me if I'm wrong, Michael, this is going to be every other Wednesday starting next week, the 15th, every other Wednesday at 4. And you're not going to join us here. You'll join it at the Teachers Health Trust Facebook page.
Okay.
Correct?
That's true.
Okay.
Unless you want to take it on all the time.
We had a great time. I'll be quite honest. It's so good to see especially the Alto part of things, because now I know who these wonderful people are. So I'm pretty, I already knew, Mike, his team.
It's good to put faces to the people behind the scenes, the people that we never see.
Too well at this point, right?
But
that's great. We love it.
Next week.
Go ahead. I was going to tell them it's behavioral health next week. We're going to focus on and talk to our new behavioral health medical director, talk about the differences in the program, and keep encouraging you next week to keep using Alto too.
All right. Good. Well, yeah. So join next week. There'll be an announcement if they're going to keep it here or if they're going to put it on their page. Doesn't matter to me. I don't care either way. But thank you guys so much for joining us.
Yeah, and Jeremiah, just to piggyback on Michael's comment real quick, for Alto, really simple process. If patients download the app or go to alto.com, if you want to try us out, the transfer flow is pretty easy. And then you can chat with our support team just live right on alto.com or via app. So pretty straightforward, and just want to make sure we can help you guys during COVID.
Yeah. It's also on our website too, where you could actually transfer your meds right there.
And transferring meds was so easy too. It's just like
Yeah.
contact my old pharmacy, and you didn't have to do anything else.
Yeah, you know, and Jeremiah, the other thing I was going to say too is this has been a very content rich Facebook Live / podcast. So I like, and I know that we are probably going to have more people that are going to view this after this has
Yeah,
ended.
for sure.
I encourage you to please share this, because this information right here will probably help your colleagues all over the valley. So it's quite simple. Just share it. And again, this is going to be very helpful for people who are trying to navigate this wonderful changing system of health. And again, this might get a couple of our new users over to Alto, which would be extremely helpful for them as well.
Thank you.
Appreciate that.
Thanks so much, Gene. We really appreciate the time.
Appreciate
Absolutely. Thank you.
Thanks, everyone. Everyone stay safe. Take care.
Thanks.
You
Join
too.
us. Join
Okay,
us next
thank
week,
you.
guys. Have a
Bye.
great rest of your day.